wine rack.
Yeah.
And I do enjoy the wine. Hello, everybody. Welcome to another episode of Let's Talk Lake County. There we go. I'm your host, David Rich, and tonight we have the fabulous Lake County Coroner, Jennifer Banek. Hello, Jennifer.
Hey there.
How are you?
Hey, audience members.
Hello. Jennifer has been on my radio show a couple times, or on the radio station's shows a couple times, and we discovered my first interview with her that you came into this studio, that we actually went to high school together. I always enjoy mentioning that because it's like such like a out of nowhere sort of thing. We're like kind of like just asking each other about our backstories, and like we lived like down the street from each other, and we were at high school at the same, but we never knew each other. Just small world kind of stuff. I don't know, like that's kind of stuff that just tickles me. Anyway, so thanks for coming on. Let's talk Lake County. I'm very excited about this, trying to get this show up and running for people such as yourself, so people in Lake County know who their politicians and policymakers are. Beyond that, just trying to interview people and just with cool things to contribute to Lake County. Anyway, let's get going. So what's going on with the Lake County Coroner's Office?
What's going on with the Lake County Coroner's Office? Everything is going well. We've done some kind of cool things in the office. So I'd love to share that with your listeners. And I know that the coroner's office, kind of when we say that, it's a pretty sobering thing to think about. So me saying we've done some cool things might sound a little counterintuitive. Right. That being said, I think we're charged with. Everybody should be trying to put me out of business. Right?
Yeah.
I feel like preventable.
It's one of the paradoxes of things like coroner's office, or even like just healthcare in general. Like the more it sort of thrives on sick people, but it's trying to get rid of sickness.
Yeah. Well, I would be happy if we could get rid of preventable death, and I'd be okay with being out of a job if that's how it came about.
But getting rid of preventable death, everybody would still die of a natural death, which is kind of like the best we can go for is like a natural, peaceful death and that kind of thing. That's what we're shooting for. Yeah, preventable death is one thing, but you're still going to die. Sorry.
Yeah, let's get rid of the homicides, the overdoses, the 100%. Suicides.
Yes.
Let's help with mental health and all of those good things.
Absolutely.
So one of the things that we have done is we always had a partnership with Gift of Hope, and Gift of Hope is an organization, as your viewers may or may not know, that works with families of loved ones who have passed away. They're interested in donating tissues or organs, for other folks. And so we always had a partnership with them, so to speak. I'll say that kind of in air quotes, and that, it was something we thought was important, and our deputies had information to access Gift of Hope and tell them about folks from our office that might be Gift of Hope candidates. However, none of our referrals really resulted in any tissue or organ procurements or donations.
None of them?
No. And it was a little bit of a wonky process. By that, I mean that our deputies have a lot that they're doing in terms of the death investigation process. It was up to them to really identify a decedent that they thought would be a good candidate, that had a family that was interested. And then of course there's the other logistics and coordination required to make sure that the tissues are something that, we are able to utilize, and, all of those things. So what we did, though, however, is we worked with Gift of Hope, and we created our computer systems are now somewhat interoperable, such that the minute that the deputy puts the information regarding the case into our electronic case log, a representative from Gift of Hope gets that information immediately. And so then it becomes the onus is on now the Gift of Hope representative to really sift through, the decedent and their candidacy for organ procurement. And so don't quote me on my numbers, but let's just say that our referrals have been definitely in the hundreds. And then we've got to talk with the families. And like I said, we have to make sure that the tissues, that there's a good match. I think we've now had, I would say somewhere between 35 to 40, don't quote me on the numbers, actual organ and or tissue procurements.
Nice.
And, yeah, that's pretty cool. It's really taking nobody expects to be working or interfacing with our office, but it really takes a moment of tragedy, and I hope turns it into a moment of hope for another family. And I think oftentimes people think of organ procurement as, a heart or lungs or kidneys. And indeed that's true, but it might be tissue. It might be a heart valve. It might be skin. It might be cornea. It could be, a number of things. And those are definitely helpful to folks. It's kind of neat for me as a nurse anesthesiologist. I've done cases for organ procurement, and I've also utilized some of those cadaver tissues, for patients that need them. So I've really kind of seen the full spectrum, which is kind of neat. So, yeah.
How does one get in, like somebody from the public get involved in Gift of Hope? Is like, how would they donate their organs or bodies or whatever it is? How do you do that?
We actually, I don't know if, David, if you have like a page, we actually, like everybody else nowadays, there's actually a QR code that people can scan, and if they're interested, they can sign right up, and they can become a participant in Gift of Hope. I would. I'm trying to think. We should probably get, now that I have the opportunity to talk to your audience about it. I wish I could say go to my webpage and you can see the QR code.
But of course, you could always just Google Gift of Hope Lake County,
yeah.
and
Yep. I want to make it as easy as possible for people. So anyway, good question.
No, yeah. Is there still the opportunity, like on the back of your license, to kind of fill out organ donor or something like that? And is that the same sort of avenue that one would take to do that? Or
I think there is. Although I had my, what, David, I turned 50. I bet you turned 50 recently too. And so I had to get my
54.
54. Okay.
You were a freshman when I was a senior. I think we figured that.
Well, all those good things that come with turning 50, right? You got to get your driver's license renewed. You got to get a colonoscopy. You got to all the things, right? Get your eyes checked.
Do women have to get colonoscopies?
You should do women?
I thought it was just for men.
No. Absolutely. Women should as well. And I believe it's actually, the threshold is now 45. Definitely.
Yeah, they dropped it. I asked my doctor if I can get grandfathered in. And he says science doesn't work that way. I'm like, okay.
Yeah. And then you just pray they don't find anything, so you get another 10-year reprieve, right? So, but I didn't look at my driver's license when I turned 50, but I think it might be, yes. And that if that indeed is something you do, then yes, it's the same thing.
Okay. So. Okay, very cool. Well, that's very cool. Yeah, no, I'm guessing obviously the lack of like the one-on-one like request to actual like fulfilling the request has to do with that they don't have enough to provide you, right? It's not of any sort of like maliciousness or aloofness. It's just they don't have it.
Right. Absolutely. Yes.
Yeah, sure. And so there's a way. I'll have to check my. You got a gentleman walking behind you.
I know. Strange men are walking around in my house. That's my husband. It's okay. We'll let him walk around.
Okay, cool. I see we have similar styles in hair.
Yes. Yeah.
Okay, very cool. And so let's talk about the dashboard thing, because it's something, like I said, right before we came on, I noticed that, and it seems very interesting. What is that?
I see the coroner's office as really, I know lots of your listeners probably think of like Quincy ME, if they're old enough like you and I. Quincy.
Yeah, I remember Quincy.
You might still find reruns in the middle of the night on some obscure channel, right?
Yeah.
And, indeed, some of our cases are kind of CSI-like and, in that capacity. But
that's kind of cool.
Yeah, but many of our cases are just, frankly, have to do with opioid overdoses and suicides. And
opioid, really?
Yeah. Oh, yeah, for sure. We assume jurisdiction over any suspected overdose. Yep. So because I see our office as really a public health service to the community, all of our numbers are subject to the Freedom of Information Act, meaning that somebody can either come and look at records on our computer, they can fill out paperwork and say that they want access to our records. So people will call and ask for that information. Of course, I'm obliged to give it. But it seems kind of like a way to, you're kind of micromanaging the data, right? Additionally, we also do an annual report. I don't know, David, have you read my annual reports for the last 3 years?
No.
Yeah, Lake County residents have not. And so And I don't blame them. I mean, like, I don't blame them. But that being said, it was a vision of mine to create like a dashboard that really brought those numbers more to life and helped people understand and appreciate what's going on here at Lake County, to kind of tell a story, so to speak. And so rather than have those numbers, that in a annual report that people have to look for or open up and likely don't open up, or they have to call my office and fill out that paperwork. We put it in this dashboard. And if you take a look at it, you can go to the Lake County Coroner's webpage. And so we have 3 dashboards for homicides, suicides, and overdoses. And it's a much more real life or live time representation of what's going on here in Lake County. And it's a heat map. So you can see where areas are of more significant concern than others. And so, my hope is that the information is much more available. It's more digestible. I hope that legislators and policymakers and county board members and all those good people will look at that information, and it will be helpful as they're making decisions about where to place the resources that are, desperately needed in those communities. So.
Wow, that's really interesting. So it shows you, like, just gives you a visual image of like the distribution of these different things going on here. Wow, opioid. Like, I hear about opioid as being like a national problem, but I guess I don't know why. Maybe it's just because I'm not seeing it day to day that it's hard for me to like wrap my head around that it's a huge issue in Lake County. Does that make sense? Like, I mean, I'm not trying to be like, morally disconnected to what's going on, but I just don't see it. So like when I hear things, I'm like, well, I remember when I first moved back here about 8.5 years ago from Portland, Oregon, which is a city which had, cities have homeless people. I came back here and I was talking to a friend of mine about like pads or something like that. It's like a church interactive. I'm like, there are homeless people in Lake County. He's like, oh yeah, tons. I'm like, what? Where are they? So like, I like that I can like hear this kind of stuff because it's something I don't think about day to day. It's good to know.
Yeah, it definitely is. In case anybody was wondering, it definitely is an issue here in Lake County and frankly across the country. And numbers definitely are overdoses that involved fentanyl have really increased multifold. But then there's, of course, overdoses with other things. And the overall overdoses keep creeping up. So it's definitely a concern. So
that's interesting. And maybe we can have you back on sometime to talk about this specific issue because, like, I mean, I've had interviews before, maybe even partially with you, I don't know, about the fentanyl crisis. And I have friends that are doctors, ER doctors and otherwise. And I remember talking to 2 of them, and they both said that the medical side with fentanyl is not what's causing the problem in the general public, but other people are saying, yeah, that's exactly what's causing it, or at least in part. Do you mind if I ask where you stand on that?
Well, I guess I would say that I think our substance use disorder arises from a variety of different reasons, but sometimes it's a little unsuspecting. I believe I've read some data before. Oftentimes it starts with just very normal issues that people deal with, like they have chronic pain, back issues, they've had like a knee replacement. And they're given, something so fentanyl is part of a class of drugs belonging to opioids. And so they might be given this as like within a very legal and prescribed fashion to help with that pain. Also cesarean sections, when women have a child and they deliver by cesarean section, that's also sometimes a way that this substance use disorder can develop. And, when they get past the time that, they should no longer be utilizing that opioid, they've developed, unfortunately, an addiction. And so they look for different sources, and sometimes those are street sources. And what they think they're getting is not always what they're getting, but fentanyl can be given. And as when I work as a nurse anesthesiologist, it's a very nice medication and definitely is helpful for people. sometimes we've had cases where folks have tested positive for THC and fentanyl. Those are the only two things. And so obviously here in the state of Illinois, medicinal and recreational marijuana are both legal. And I suspect that though that marijuana probably came just from off the street, it didn't come from a dispensary, and it was contaminated. I mean, how unfortunate. Yeah. So
some of the stuff you find people with THC in their system that are having an overdose, you think it's because the pot was tainted in the first place?
Oh yeah, it's because of the fentanyl that it was tainted with. It's not because of the THC.
See, that's crazy. I'm going to go ahead and put myself out there now. I mean, I smoked pot growing up when we were in high school and everything else. I never, ever, ever had a problem, like ever.
Yeah.
So like it's a whole new world now. That's one of the reasons why I'm glad it's become legal, is so people have the option to be getting it through safer venues, because that stuff is super safe. Wow, that's crazy.
Well, and I don't know if the THC is intentionally contaminated by the dealers, if it's coming from the street, or if it's just accidental, it was caught with something that, had fentanyl on it and it was like an unintentional, unfortunately, I can't to that, but.
Okay. All right. Well, that's good enough. Well, all right. Did you want to discuss your campaign at all and what's going on here? Are you running unopposed?
I am running unopposed in the primary, not for the general.
Oh, okay.
So, I had an awesome army of volunteers who I think I needed 697 signatures, and we got over 2,000, I believe. Which
you needed how many?
697.
Huh.
And
so what was it? Can I ask you this real quick? I mean, because like with being the Green Party, a third political party, like ballot access is like our greatest obstacle. So I know a lot about this stuff. Like, so what would it mean if an incumbent didn't get the 600 whatever signatures? You can't run?
That's right. I wouldn't be on the ballot.
That's crazy. Even as the incumbent, like you would assume like it's just a given that you would be on because you're the incumbent, but okay.
Well, I think it's a way, for public servants to we should have to work to get on the ballots. It's a great opportunity to get, have interface time with the public. There's some states where you can, my understanding is you can just pay a certain amount of money and, gain access to the ballot. Listen,
how is that not extortion?
Getting those signatures is really a lot of work, but it was quite satisfying at the end. And I think I had about 75 volunteers who.
Oh, wow. That's great.
Yeah.
That's a testament to your people liking you. That's good.
Yeah. Well, yeah. I mean, they like me that they got those signatures for me. But yes, I am very thankful for the work that they put in doing that. So, let's see here. The primary is, I believe, March 19th. I think February 8th, if I have my dates correct, is when people though can start early voting. So just making a plug for that. That's a good thing to do. Making a plan to vote just in case, March 19th doesn't go as you expect it to go. And then, we'll head into the general election and we'll see, the summertime is when we do parades and maybe you remember last time. I know my phone is really dinging. I don't know how to turn that off here.
Okay. I was wondering, where's that coming from? So
I'm not sure. And I'm being polite and not looking. So somebody's on fire there. The summertime we'll be doing lots of parades and really getting out and talking to folks. Yeah.
Well, that's cool.
Yeah. Oh, I was starting to say last time, do you remember when I did my be fast, run fast or be last, and I was running around Lake County?
Yes.
Do you remember that? Yeah, I'm not doing that this time. So at least I don't think I'm doing it. My knees are asking me not to do it.
Yeah, my whole body's asking me not to move much anymore. So anyway.
You're not gonna join me on a run?
No, hell no. Not a run. I'll drive next to you. Which is too. I used to like swim and stuff. I was in great shape, and now it's just anyway. Whatever. But no, that's really exciting. I mean, I love knowing kind of like the ins and outs of campaigning and like having people like you that I can just kind of like refer to, like, almost whenever I want to. Like I get in the ear a lot of like Aaron Weinstein and Holly Kim about this stuff, and they're going to come on the show too. And it's just fun to hear about like the behind the scenes of what's going on in like Lake County politics and stuff like that. Like, it's cool. It's one of the reasons I wanted to do this show, is to get that kind of information, like not the scandals, but like this information out, not that there are any, out to the viewers of Lake County, because I think there is a bit of a disconnect between, I think like local and county level kind of get lost in the political shuffle. I think people are so much focused on like the federal level, and like your day-to-day stuff is more shaped by local and county politics than federal, easily. So I think it's important for people to know about it. So,
well, and it's good that they do, because like, frankly, we're far more accessible.
That too. It's far more of a direct democracy. People can go to you and like, actually go to your office and say, hey, I don't like this, or hey, I love this,
Yep.
So okay, well, good. And so you're running, like, there's a Republican candidate in the general primary or general election? Oh, sorry. I guess I wasn't supposed to say that. But okay, well, that's cool. I guess we'll figure out who that is later. Cool. Well, very, very, very cool. Is there anything else you wanted to say or plug before we call it?
I would like to give a shout out to my staff. They really do a great job from day to day. So I couldn't do things like the dashboard and the partnership with Gift of Hope without them. I guess I'll mention two other things that I can think of. We did do an indigent burial. It was probably in October timeframe, which was the first time we've ever done that in Lake County. So that was, I think, a very nice opportunity to give everybody, put everybody to rest, like, respectfully, like they should be. So, somebody that's an indigent maybe has family that can't afford to do the final disposition for a loved one. Maybe they're unhoused folks. We had some cremains from some folks who, like, they moved into a house and there were a couple of urns that were there. Cremation has become quite popular. I think people don't necessarily think about what to do with their remains after the next generation, because the immediate generation might find that very meaningful, but the following generations are like, what
your great grandfather's ashes? Like, oh, big deal. Okay, you like tap your cigarette butts in there.
So hence our friends that were found in the house that was, for sale. And so, we were able to lay those people to rest, which I think was
that really is very cool. Yeah, that's really interesting. So you, like, wasn't it true, if you don't mind a couple more minutes, like back in the day, like anybody who died was given an autopsy and like that stopped happening, or do I have that wrong?
Anybody that died was given an inquest. They all went through this process that was called an inquest. I don't know. You might have your facts more straight than I, but I don't think so. And, sometimes, unfortunately, families call and they want us to do an autopsy. And, there's a physician that signed off on it. The fact that the person passed away isn't surprising. An autopsy costs around $1,000, and there's 6,000 to 7,000 people that pass away in Lake County every year. It doesn't make a whole lot of financial sense to do an autopsy on all of them. We do autopsies on anywhere between 600 and 700. So
does the family have to pay for it?
If they want, they can absolutely pay for an autopsy, for sure, but not if we assume jurisdiction. No, if we assume jurisdiction over it, then there's no cost to the family. Okay. But if they say we still want an autopsy, they can get one from a private forensic pathologist, and then it would be at a cost to them. Which leads me to the fourth thing that I guess I wanted to tell you about, was that the deputies in the office have really done a great job with closing out investigations very thoroughly and efficiently. So, we do the autopsy and then we send specimen off to one of two labs in the country. There's only two labs that will do testing. That's kind of our rate limiting step. It takes about 4 to 6 weeks to get those tests back. But the deputies will then close the case in about 6 weeks. And so most of our cases, and when I say most, I would say probably almost 90% the investigations are completed in under 60 days. And many counties, I think their investigations go on for probably about 3 months or so.
Wow.
The benefit to having the investigations completed is that their loved ones are able to get a permanent death certificate. And the permanent death certificate is important because they're going to need that to take care of like legal things to close their loved ones' accounts, or sell a car, or whatever the case, or take care of insurance, which of course is really, some people are dependent on that if they were dependent on their loved one. In addition, then the data is available, when people want to know about opioid overdoses or how suicides are. But if they're open for, several months, then the data really is quite skewed.
Sure. That's interesting. Okay. Yeah. Well, I think, I might reach out to you in like a couple of months to come back on and talk about this opioid thing, because it's super important. Obviously, you hear about this stuff, the fight and debate over it, the national concern about it. But bringing it back again to home, to Lake County, that's interesting.
So people in Lake County should know that as part of a settlement, that for 18 years, Lake County will receive $218,000 a year. But it needs to be dedicated to resources for the opioid crisis. And so we recently hired a opioid coordinator. I was part of that interview process. That person's job will be multifold. Number one, they will help to determine the capacity that Lake County has, like where can people go for help with substance use disorder? What kinds of resources do we have on hand? Because there's kind of lots of silos. That person will help bring, and that person's already hired. Her name is actually Liz Nelson. And then that person will also be in charge of developing a process by which the other funds that we get can be released to other organizations doing good things to help with folks struggling with substance use disorder. So she'll develop because we're using some of that money to pay her salary and her benefits and things like that. But then there's other money. And there was I think $88 million is coming to the state collectively, but Lake County will likely be a recipient of some of that. So we want to get those resources out, but we need somebody that will vet the requests. So that will be that person's job as well. So
very cool. Yeah. I mean, if you're watching this and you're having any sort of troubles with substance abuse or opioid or otherwise, there's lots of opportunities now to get some help for sure, and less legal pushback on you too. I know it's called something, and now I can't remember what it's called, but I know Mundelein Police Department, for example, has it, and I think there's many others, if not all others, in this county, where you can just go in there and say, "Hey, I'm doing this, and it's to destroy my life." They're not going to arrest you. Is my point.
Right.
They won't do it. They'll get you the help you need, which is wonderful to see happen.
Yeah, that's, a lot of that is because of the good work that our state's attorney, Eric Reinhardt, is doing. But there's things like drug court and a way out where, if you're willing to utilize the resources that we have to try to get help, and, that like you said, there, that's the process by which you, by the journey that you take, when something's gone sideways. So, yeah.
Exactly. Well, very cool. Very well said. And I'm trying to get Eric on the show too. He promised he would about 3 months ago. So I'm hopefully he'll come on soon. I love talking to Eric. He's very, very, he just knows it's interesting to pick his brain on this stuff for sure. So, well, very cool. Okay. So you're obviously the most popular person in the world since your phone is just pinging off the charts here.
I know.
So I'm going to let you go attend all of that. Hopefully it's all good news. Because I'm sure, as a coroner, you can sort of just anticipate some bad news.
It could go either way. Yeah.
Right. Exactly. So anyway, Jennifer Banek, Lake County Coroner, thank you so much for coming on and talking to us here in Lake County. I'm your host, David Rich. Let's talk Lake County. Stay tuned for the next one, and take care till then.
All Thanks for having me, David. Take care.
Jennifer, hold on 1 second. I want to ask something.